Hi, George. Good to see you again.
How you doing, Dr. Bravo, Dr. Rehnman? We're here today on a Tuesday morning, once again, elevating great physicians. And I think Dr. Hafiz Rehman has to be the top great physician that I have ever met in my life.
Thank you.
Amazing stories from him.
Honored to have you on the show today.
My pleasure.
Thank you for your kindness and sharing your time with us today. We always like to start, Dr. Rehnman, by asking people, why did you become a pediatrician?
As a youngster, I was involved in Kenya with the St. John Ambulance Association. This is, where you would help people with medical needs. And I was volunteering as a Boy Scout with the St. John's Ambulance in Kenya. And that's where I developed interest in children, their problems, how to help them. It was a auto accident where a kid was involved. He ultimately passed away from his injuries, but I was on the scene, and that's when I said, I got to be a pediatrician. My father, who was a very successful businessman, always told me, why you want to be a doctor? Why you want to be a pediatrician? One time when he was visiting me here in America from Kenya, he came to the office. Every single kid was screaming that day in the office. He said, you're crazy. Why you want to do that? Leave this, come and join me in business. But I loved the work that I did for 43 years. I enjoyed it thoroughly. If I have to do it over again, I'll be a pediatrician again.
Wow. You were born in Kenya?
Born in Kenya, in Nairobi. I did my medical school in Pakistan because at that time we had no medical school in Kenya. But by the time I finished med school, I went back to Kenya. I did my internship and residency of first year at the Canera National Hospital, which was the university hospital in Nairobi. And wow, what experience. You would see everything under the sky. And if you ever worked at the emergency department in the Canera National Hospital, that line never ended. The line, day or night, was at least 400, 500 people standing, sitting in the line. So that's the kind of experience you would gain in a place like Nairobi.
And so you must have seen a lot of children with polio in Pakistan and Kenya?
Yes, yes.
What did polio look like?
Say it again?
What did it look like?
The
polio,
what did the polio disease look like?
Well, you have a whole array of diseases, different from what you see here in the United States. The most common cause of fever was malaria, and you would see malaria in all forms and shapes. You would, have complications of malaria. You would treat them differently, So over the time, malaria became lesser of a problem, but that was the big thing. And other tropical diseases also, bilharziosis, polio, measles like crazy. The Canera National Hospital had a whole unit of measles. And as the first year intern there, I would fly out into the jungle on the helicopter, flying doctor service, and pick up these kids from the jungle, almost dying or dead at times, bring them back to the university hospital, occasionally do cut downs on the helicopter to get an IV into them. It was a totally different experience than what most of the doctors go through here. Bringing these kids by the dozens every day into the measles unit at Canera National Hospital. Some would survive, some would die like flies, but that was the experience with the infectious diseases.
I guess we made that all better by giving an MMR vaccine, right?
Yeah.
Yeah, it all went away.
Amazing. So measles was a pretty severe disease. It wasn't
yes.
It wasn't just a mild cold, was it?
Yeah, because most of them never got to a doctor, never got any immunizations. These were kids who, would get the most severest form of the disease, and they would be totally dehydrated by the time we would get to their place. They'll get messages. And it was amazing, how this flying doctor service would help these kids. Some survived. A lot of them, of course, it was very difficult.
They're very sick kids. And did they get a lot of diarrhea? That's where the dehydration came from.
Well, the measles would present as high fevers. By the time they have had 3-4 days of fever, 104, 105, they'll be totally dehydrated, because remember, these are kids out in the jungle, in the bush. They have no medical facilities till we would get there in this flying doctor service and bring them to the university hospital.
Wow. And how about, did you have a polio ward at the same hospital?
There was a polio unit too, but polio was more under control. There would be cases you would see paralytic polio, but they, were in a different unit. The worst of the cases were always in the measles unit.
And on the paralytic polio kids, they would die because there was no way to ventilate them, right?
Well, they would start off their sickness with mild coryza kind, upper respiratory infection kind of thing, and then go on to develop paralysis. Could be bilateral legs, could be unilateral. If it would get up to the chest and abdominal muscles, then death would be imminent. A lot of them were helped again at the university hospital, but a lot of them never made. Polio came under control because of the vast immunization that would start whenever there would be outbreaks. Every single gas station in the city, in the capital of Nairobi, would be giving drops of polio vaccine. So, because not everybody could get to the hospitals, so every possible facility. And I remember the gas stations especially, because for a whole day at one time, there was a mobile gas station in the middle of Nairobi where I, worked with them. And this was again, as a Boy Scout, I was giving the polio drops.
Wow, what an amazing story.
Yeah.
And then you came to the US, and when you started practicing, you opened up an office, and all your records were on paper, right?
Yes, yes.
And you probably knew people when they walk in the door, you could say that the child's name and what sport they played.
Yeah, it was all on paper till I merged my practice with and they taught me how to use the computer, and they taught me how to start the files on it was great. And I was wondering why I didn't do this all those years. But, everybody had just paper records to start off in the beginning. And, I brought some records home with me, my children's records. And it's amazing. I showed them, said, these are your files. Look at them. And now everything is on computer. The world has changed for the better.
Wow.
As far as record keeping. Yes.
And when you started out in Long Island, were you doing house calls? Was that something that they still did or no?
The first house call I made was a case of chickenpox. The mom called me and said, this is what is happening. And she was on Fire Island. She said, she'll send over her boat. Would you come and see this kid? I said, well, if it's chickenpox, I can't do much. But he said, still, I want you to come. And I want you to reassure our family that he's going to be fine, and you will confirm the diagnosis. Lo and behold, that was my first home visit. Traveled in a boat to Fire Island from Bayshore and checked the kid. And they were so gracious. They had dinner for me. We spent some time. The kid obviously had fulminant, all over the breakout of chickenpox. And wow, after that, there were a few other home calls, but by far that was the first one that sticks out.
Wow. And then when you were starting out, when you were starting out in practice, did you have to go to the emergency room and the delivery rooms?
Oh, yes. Yes. I think I was one of the few who would say, okay, I'll be there. If they needed me right away, I would leave the office and go. Most of the times at the end of the office hours, I'll go to the emergency room. Some kids would have been transferred if they were admitted to the pediatric floor, but they knew that if there's a patient for Dr. Rehnman, he's going to show up in the emergency room. And I did that. And I loved neonatology. I loved, taking care of the newborns, including preemies. At that time, the hospital, both Good Sam and Southside, didn't have neonatologists. So there were a couple of us who would jump out of our bed at night when we get a call and go to the delivery room and help with the newborn, intubate them, some of them. Some would just need an IV started, umbilical catheter. So all kind of things. It helped me in two ways. Number one, the experience. Number two, it helped me build my practice too very rapidly. And almost all obstetricians knew that they could rely on me coming in the middle of the night to help them at delivery time. Then with time, of course, neonatologists came and our life became a little easier.
Do you miss the relationship with the OBs? When you were there
Yes.
in the delivery room, you're talking about, how the mom was and the whole thing, and they're asking you about the kid, and you just have this friendship, right? This kinship with the obstetrician.
Yes, they were very helpful. They were always there to help my practice. And of course, I paid back by being there for them. And believe me or not, all very sick neonates were usually transferred to a tertiary center. But once I and another couple of pediatricians got involved, we were able to hold on to many babies right in Good Sam and Southside and see them through till discharge time. And then, of course, as I said, the neonatologist came and our life became much easier.
Wow. And
I was one of the few pediatricians who would do all the circumcisions. Some obstetricians liked it. Some didn't like it when we took their job away. But till the very end, I continued to do circumcisions. I continued to do little procedures. Dr. George would tell you, that tongue ties and small abscesses, that were all taken care of very quickly right in the office. Sometimes right in the newborn nursery, tongue ties would be clipped. And nobody else amongst the pediatric staff actually did it. Then some saw me doing it and said, can we do this? And you stand by? And I said, sure, why not?
wow. And so the practice of medicine and the practice of pediatrics has changed quite a bit over the last 50 years. Neonatologists, pediatric emergency room physicians, pediatric intensivists. Has it become better or has it become worse?
Your opinion.
In your opinion?
Has it what?
Become better or worse?
Well, better in the sense that you have all the subspecialists, you have the neonatologists, they take care of all the cases. And in that way, it has helped the pediatrician. He could spend more time in the office. He could, deal with cases right in the office, not have to run to the emergency room. But you miss on the experience. I enjoyed it always, getting involved with the difficult cases. I loved, helping the kids. I loved helping the patients. And that has been taken away from the pediatrician. So there are good and bads about that. I think the experience that I gained in Nairobi, Kenya, in Pakistan, and in the initial stages here in America too, is very difficult to come by for a new resident today.
Absolutely. Do you think that the miss that where, you know, your pediatrician was in the delivery room, met you in the emergency room, came over to the house and took care of a kid with chickenpox? Think the families miss that?
Oh, of course, you know, the relationship that you develop with a family right from day one of the newborn coming into the world, and for the next 18 years, 20 years, 24 years, whatever time limit you set in your practice. I had a fairly large adolescent medicine practice also, right from newborn period. And Dr. George would tell you all the first generation and second generation patients. You took care of the parents, then you took care of their kids. It's been an amazing experience. And a time came when I started to take selfies in the office of my second generation patients. And they were all on the wall. And some patients would say, why don't you take my picture? I said, because your parents were not my patients.
Yeah.
This is a specialty, a special privilege for the second generation, where I took care of either the father and the mother, sometimes both of them.
Oh, wow.
And then he advanced it and he put it on Facebook.
Very rewarding.
That was very nice. We have the Dr. Rehnman Wall of Fame, where it always amazed me when I first met Dr. Rehnman. I went to his office. He had these walls full of little pictures of kids they would send for the holidays. There were just like thousands of them all over the place. You know, when we moved out of his office and we renovated our new office with his office, we had to bring a little bit of that with them. So we took pictures of his pictures, put them in nice frames, Dr. Rehnman kids. I mean, it's like a tribute.
Yeah. One time a colleague came into my office and said, you're not supposed to do this, take pictures. I said, why? He said, you have to have a written permission from them. I said, no, I have such good relationship. I can rely, I'm not afraid. And not a single time did a parent ever refuse a picture taken, and not a single time anybody refused that picture going on the wall.
Yeah. And now they see those pictures in the new office and they just love it. It was very funny. Yesterday, I saw Dr. Rehnman's grandson from London. He comes with the daughter. And I said, let me show you what we had with your dad from the old office, because she used to work in his office. She looked at the pictures and she goes, oh yeah, I know these pictures. There I am, there I am, there I am, there I am. She's like all over the place. She knew exactly where they were. That's amazing.
She volunteered a few summers, you know, from college. She volunteered in the office. So she had quite a few pictures there.
Yeah, she was there all over the place. She knew exactly in which picture and what frame was where. So there's something to say about that.
The little kids used to go up to the picture wall and point to themselves. That was like something really exciting, that, you know, their picture was there.
I agree.
That's obviously not, we don't see that very often anymore.
I mean, that's the human touch that we keep talking about.
Yeah.
All these screens and computers, it's just disgusting.
Now, Dr. Rehnman, you do a lot of advocacy, both in your local community and the global community. Why?
You know, besides doing pediatrics, I was involved in the community in many different aspects. I'm still a human rights commissioner for Suffolk County. It takes a lot of time, but very rewarding being on the Human Rights Commission of Suffolk County. We would get all kinds of cases. We would have all kinds of deliberations. Was an honorary Girl Scout and being on the board of Girl Scouts of Suffolk County was another very rewarding thing. Number one, helping the girls choose many different aspects of their future life and helping them making decisions, and attending their board meetings, you know, would also be learning for me, learning for what the problems are out there in the society. I have been on the anti-bias task force of Suffolk County as well as the town of Islip. And again, you only know of these problems, bias crimes, when you really are on one of these boards, that you see what kind of things happen out there. And you're able to help with resolution. In town of Islip, we started what was known as a junior ambassador program. Students from high schools would come once a month to the town of Islip town hall, and we would lecture them, show them videos, show them movies on anti-Semitic crimes, on Islamophobia, and on black and white relationships in the community, and all that. As a pediatrician, I could perform maybe a little better than other people on the board. It again was rewarding. Both of you would be happy to know that I was given the Martin Luther King Award in Suffolk County a few years ago. I was also on the board of Suffolk Community College. So besides being pediatrician, I can go on and on with the number of things that I did. And I have in Kenya, in the north of Kenya, one of the poorest and the most remote areas, an orphanage. And this orphanage now has about 400 children. I take care of their needs. I provide them with school education, and I provide them with meals. Because of my own sickness, have not been able to travel there in the last few years, but I used to go once or twice a year to this place known as Banane in north of Kenya, where this orphanage exists. Again, a very rewarding thing. Again, I would recommend, when residents would come to my office for rotation, I would make sure I show them the pictures of that place, encourage them to be part of volunteer work. Give some of what you are learning to the poorest of the people in the world. There is so much misery in so many parts of the world. There's such poverty and such need of medical help that the residents and the interns could provide some of that help. And I always encourage them. And I think I was successful in sending quite a few residents around the world. After they had seen my work, they always wanted to go and do some volunteer work. Very rewarding.
I guess Dr. Rehnman didn't need a marketing department for his practice with all these board positions. Everybody knew him.
Wow. Wow. And you also played a very important part in interfaith relationships. Am I correct in that?
Yeah, the American Medical Association's monthly journal at one time published me a pediatrician and a mosque president. That was the title. And they wrote a whole full page in the AMA journal, in the AMA and newsletter. And a lot of good things came out of that article too. But a lot of people from the mosque knew that I could give them advice on religious issues, on ethical issues, on end-of-life issues, making decisions when somebody has been on a respirator for 3 months, 4 months, and they want to see which way to go. They were able to count on me, and I was able to sit down with the families and help. And that again is a rewarding thing. And people, would come forward and ask all kind of Islamic issues, health-wise and otherwise too. And in coordination with the Imam and the mosque, in coordination with the Islamic Medical Association of North America, of which I was a past president, I was able to help many of those issues. end of life is a very, very difficult situation for the families. And if they can, rely on somebody for proper advice, both from the medical as well as a religious point of view, it was helpful for them.
Wow.
Well, what advice would you give George and me at this stage of our career?
Well, he's given me a lot of advice since we started
Well,
working together.
the only thing I would say is get involved in some relief activities, medical missions to third world countries where they could use our help, where they could use, a visit from an American doctor, and it'll be a learning experience for yourself as well as a great help to the poor of the poorest.
Yeah.
That's
That's
wonderful
wonderful.
advice. What haven't I asked you that you want to share with our audience about being really a community leader, a community in pediatrics, a leader in the medical societies, an awesome pediatrician, a great partner? What haven't I asked you that I think is really important lesson for all of us to remember beyond volunteering?
Be a good doctor. Just be human, right, Dr. Rehnman?
Well, my heart and soul was always in pediatrics, and I never thought that I would retire. What forced me into retirement was, my kidney disease. I have chronic kidney failure. I'm on dialysis now. And a time came where it became very difficult to continue working. I always thought that I would be working as a pediatrician till my last. Never thought of retirement ever as part of my life. I wanted to continue working, but health issues forced me into retirement.
But you're not really retired. You're still part of the team. Waiting for you to come.
Yeah.
When people ask me about you, I said, yeah, he has some health issues. When he gets better, he's coming back. 4 hours, 5 hours.
So many of our patients, friends on Facebook, and they still, would ask for advice. I said, well, ask Dr. Raghu. But they said, no, we want to talk to you. I said, I'll give you my advice. But now you're in good hands with Dr. Raghu and his office. His staff is wonderful. All the associates in that office are wonderful. And the patients, I think, started after a couple of years now, started to realize that Dr. Rehnman is not going to come back, but he'll still be there in the mosque,
on the wall,
in some other places where they can ask me advice. Every single Friday, I have at least 10, 12 patients who are in the mosque, the parents, they'll surround me, and my other friends would say, come on, leave them, now you are retired. But it's still rewarding to talk to the patients.
Yeah, it is. Now, what advice would you give to some residents coming out of residency, pediatric residents graduating today? Because it seems like they don't want to go into practice. They want to work for hospitals and,
Well, the advice to residents, their medical knowledge is good.
Well, they're all good.
They are very thorough, better than what we were as interns and residents. But clinical sense is something that I've seen lacking. They're afraid to put their hand on the belly. They're afraid to, do little things which can easily be done in the office. It's a hands-on experience that can improve, with them. And that's why I always advise them. I said, you don't have to do a CAT scan and MRI for every little thing. Use your clinical judgment also in making a decision what may be wrong with the patient. Of course, labs and blood tests and other things have improved tremendously the outcome of diagnoses, but rely on your own clinical sense. Make decisions on your clinical sense. And I think a lot of the residents picked that up from me.
Yeah.
Do you think that clinical sense comes from listening to the families?
Clinical sense, what?
Comes from listening to the families?
Well, as a pediatrician, if you're not paying attention to what the mother or the nurse is saying, you're going to miss things. Being a good pediatrician means you have to listen to the parents, never ignore what they're saying, never ignore the nurse in the pediatric floor. If she's telling you something, you have to pay attention to all that. It makes you a better doctor. It makes you a better person if you are listening to the parents. If you are listening to the child is going to improve. It's going to get better. Your treatment is going to make him better. But be friendly with your nurses, be friendly and listen to the parents. Extremely important.
Yes, I think that's very, very important. Perhaps it's done less nowadays because of all these computers and electronic medical records.
And testing. Dr. Rehnman, remember Dr. Brown from Russian Brown and Kaplan? Bob Brown, way back. He taught me that children will get better despite what we do to them. If you give them a treatment or a therapy, you might make them better a little faster, make them feel better a little sooner. But the true art of pediatric medicine is to see in the sea of 100 normals, to see the one that's not. And I've seen you in action many times. You'd walk in and you tell me, oh, he has this. He doesn't have what you have, what you think. That was truly amazing. That's what he taught me. And I've seen Dr. Rehnman in action in that many times.
Yeah, one of the things that I always did, you know, when you're examining the kid, they're going to scream, yell, and be afraid of you. And sometimes very difficult to explain things right in the examining room to the parent. So right from the very beginning of my practice, after I finish the exam, after I've done the throat culture or taken the blood, whatever is necessary, I would invite them into my consultation room and sit down with them. The child is now quiet. The parents can pay attention. And this practice continued right till the very last day that I practiced. I brought them into my office and you know, talked to them. Not only you would make sure that your message has gone across to the parent, but they would feel more comfortable and confident in what you're doing. And, you know, the most important thing for a parent is the well-being of their child. And if they can realize that you're treating their child as your own child, you will be a better doctor, you will be more respected. Of late, after I had grandchildren, I would tell them, okay, your child is like my grandchild, not my child, but my grandchild, because that's whom you love even more than your own child. And they would be very happy with that.
Yeah, that was a practice that Dr. Rehnman used to do, where he'd examine a child in a room. They would order, I think, vaccines and things. And then after they were done, they'd send them back to his consultation room where they'd sit and they'd wait for him to come back again. That was something that I just could not get into because I was on efficiency. So I wanted to go do whatever you have to do, get out and move on. So we do those things inside the room, I guess, at the end of the day, but he had a thing going. So he continued it to the very end. It didn't jive with us, but who cares? We did our thing. Dr. Rehnman did his thing. It was always Dr. Rehnman show.
Yeah. I love that idea. I think especially with the newborns and the first-time parents, where they need a lot of cheerleading, because it's scary to be a new parent with this little baby at home. That sitting down and having a conversation and helping them gain the confidence has tremendous value. It's not done very often because the offices are not set up like that anymore. but it was the old school way of building up that relationship. Then later on, I don't think it was needed. You've been right most of the time. You just tell them it's a cold, don't worry about it. They give you a hug and they leave the office. They didn't need to sit down in the consultation room anymore.
Yeah, not only, patients in the office. I would encourage every expectant mother, if she wanted to come into the office and sit down with me half an hour, to decide whether they would want me as a pediatrician. So, expectant mothers, and I told the obstetricians, please send them, no fees, just make an appointment, come in and come and talk, so that whatever discussions they want, what to expect, I will be there to answer their questions. And I was always big on talking about nursing as opposed to formula, and encouraged, breastfeeding all the way till the kids were about past their first birthday or even a little longer. And I think that is something that may be a little lacking today. The pediatrician of today has to be an advocate of breastfeeding, because it's such a unique advantage for the baby.
It definitely is something that we need to advocate for every day.
Oh, thank you. Anything else, Herb?
No, I
I'm out
could,
of ideas. You can talk to Dr. Raymond all day long. And he'll
I
talk
could,
back.
I could spend hours and hours just
Yeah.
learning from his experience.
Yeah, we tried when we merged with, what we did was different than whatever, the hospital systems do. He had some trouble with the computer. Eventually he got it. We put a scribe for him to help him, and then he could do his Dr. Raymond thing and make people better. We tried to pick up whatever good things was from the old school and bring it into the new school. And a lot of the doctors understood it. And I've noticed, Dr. Raymond, that the culture changed of RBK since you had joined. The doctors, even me, we all changed a little bit to be more humanistic, to be more talking, to be more with the patient, as opposed to just the medical record and, the provider thing. More friendly, more, I think that's important. And people lose sight of that, and I think that changed the whole culture of RBK Pediatrics, because everybody's following in that. And I think the way it works is somebody learns from somebody, and then that all trickles down. So I think Dr. Riley, myself, Dr. Belovin, and everybody, Nick, we all started to follow your way. And then with the new generation, by accident, it's infused into them. No, I don't know.
No, I mean, he's a phenomenal leader. Yeah. And, that leads you to want to emulate his actions, because, his life of work speaks for it. The leadership and the kindness with which he has treated humanity from the time he was a young person and still today. And it's very humbling and wonderful to have you here to share these insights with us.
Thank you.
Thank you, Dr. Rehnman. Thank you for teaching me.
One of the things that, if I had not gotten sick, I would have asked Dr. Raghu George was to teach me something on that music, his band, his guitars. I see them in the background. What a wonderful thing to be involved in, other than being a pediatrician.
Yeah, you gotta do other things just like this. All right, so we won't take your time up anymore, Dr. Rehnman. It was a pleasure. I love seeing you. I love it when you come to the office and just say hello. You saw what happens when you come. Every Dr. Rehnman is here.
Yeah, well, I'm not too far from your office, so
come on down.
I'm going to periodically, as my health permits, maybe stop by.
You got to see a tribute to the Wall of Fame, Dr. Rehnman's kids. Everybody loves it.
All righty.
Well, thank you for your time and best wishes to you. Thank you for sharing your insights with us.
Thank you.
Take good care. Bye.
Take care, guys. Bye-bye.